A disturbing new government report is raising serious concerns about the effectiveness of vaccines for childhood diseases if they aren't stored at the proper temperature. So what happens if the storage is too hot or too cold? We went to Cincinnati Children's Hospital to find out.
One of the things we have to make sure is that we keep them at the right temperature, because if they get outside the temperature, they can go bad, so that they aren't as effective.
Inspectors from Health and Human Services visited the offices of 45 providers in 5 states that offer free vaccines as part of a government program. They found that 76% of the providers stored the vaccines at improper temperatures.
I think doctors need to be taken out to the woodshed on this. And each state is responsible for their vaccine programs, but doctors need to look in their offices.
The CDC says the disease rates have not gone up because of the vaccines affected by temperature problems.
Nothing was going to cause any problem with safety, but it was a problem as far as whether or not it may be as effective, so it would be as good as preventing illness.
But this is a warning for healthcare providers and for parents.
It's shocking to hear that. There's going to be lots of questions, I think, from mothers.
Tracy Gregg is the owner of Reality Tuesdays Cafe in Park Hills, and she's a concerned mom.
Since I have almost a 2-year-old, a 5-year-old, and 3 7-year-olds, we've pretty much been vaccinated almost every year for the past 7 years.
Gregg thinks the health providers need to be held accountable for the vaccine's safe storage. She says inspectors check on her cafe as they should.
Here at the coffee shop, we have to, we are required by the health department to make sure that milk is at a certain temperature. Every 6 months, the health department comes to check all that and to make sure that we are serving safe.
Karen Sakura, a mother of 3, wants to know how this can be prevented.
I'm curious to know how certain offices are taking precautions to store them.
While the investigation focused on the government's vaccine program, doctors say it's an important reminder to everyone vaccinating our children.
The most important thing is that we just have to be aware as far as that the rules are there to try to keep the vaccines as safe as we can. The government came through and was just checking to see as if the doctors were maintaining things as well as they could.
And here it is, the health of our children. For me, times 5.
Times that the vaccines were out of the temperature range were actually very brief. Dr. Frank says it is unlikely this would cause any long-term problems. The CDC is vowing to improve the system with retraining and more oversight. We have the full report posted on WCPO.com. Just go to the Healthy Living section.